from Orpex.
Orpex.
But it has to be after like a payday.
Okay.
You make it with Will Allen.
That would be nice, wouldn't it? It said pause. Okay, it's recording.
Are you the video guy today, Will?
Yep, you're being recorded right now.
Oh, terrible. So careful what you say, right?
I guess some students might be coming. Come on in, you're on candid camera.
One more minute, and we're going to get started.
There.
What? Yeah, I'm not supposed to have one. Yeah, that's the one she gets.
Oh, yeah.
Oh, I need that.
All right, guys, I don't want to hold you up past time, so we'll just go ahead and start, and hopefully some other people will join us as we're talking. Um, I'm Sheila Stefanelli. I'm the heart failure nurse navigator here at Maryview. My coworker is Lynn Runke. She'll be joining me in just a few minutes. I'd like to start off with a little reflection, and this kind of goes with what grand rounds are about today, and also with Best Friend at Work Day. So respect your fellow human being, treat them fairly, disagree with them honestly, enjoy their friendship, explore your thoughts about one another candidly, and work together for a common goal and help each other achieve it. And that's by Bill Brackley. It's quite inspirational as we're seeing the transitions that are happening here at Bon Secours. I just wanted to go ahead and make sure to say that Lynn and I have no relevant financial or non-financial disclosures. So when talking about healthcare today, there are several issues identified. The biggest that they've identified are low nurse-to-patient ratios and poor education of nurses as a cause of frequent admissions. And when I put that in there, I didn't realize how that could come across when someone else is reading it. But what it's saying is the poor education of nurses is talking about the nurse being aware of the whole person, not just what they're treating, not just their diagnosis, but their whole person. Like, can they read? Do they have support at home? Do they even know why they're here? That type of thing. Also, some barriers. Patients are sicker and with more comorbidities, and there's always a lack of time, and there's a need shown for better communication, discharge planning, and coordination of care. So one of the things that we need to all remember is that one person cannot do it all. It takes a whole team, and that's the approach I want us all to have when we're looking at our patients, is that, no, the staff nurse is not expected to do it all. There's plenty of resources here at Maryview who can step in and help us with that. We just need to utilize them a little bit more than what we do. So one of the things, healthcare reform is a platform to initiate fixing this poorly coordinated care. As you all may be aware, readmissions are scrutinized at this time and can also be penalized financially. So many organizations are stepping up and creating some innovative ideas on how to handle this We try to do the best we can, but there's so many obstacles to face, just from staffing all the way down to the actual patient themselves that we're dealing with. But as you know, our mission at Bon Secours, I'm not going to read the whole mission to you, but I did highlight some there in red. As a system of caregivers, we commit ourselves to help bring people and communities to health and wholeness as a part of the ministry of Jesus Christ. Now, you do see that it says health and wholeness, and that's one thing that we're going to be talking about, wholeness. Wholeness is a complete or full, not lacking or leaving any part out. And that's where, my certification comes in as the holistic nurse. We studied on, making sure that you cross every T, every barrier that can happen to a patient that we handle it. And, as part of this healthcare reform, that is what we're obligated to do. The one thing that's great is that with Bon Secours, you can see that it's already talked about that in the very beginning from our mission. So we're already ahead in the aspect that we've adopted that culture and we've learned from our mission. We've already had that wholeness as part of the mission. So this is not new things, it's just ways of improving it. And how can we do that? Well, we can improve it through interdisciplinary care and also for all of us accepting the responsibility of the patient. Not just the nurse, but the secretary, the CNAs, the doctors, ESD, all of staff, anyone that comes into contact with that patient needs to understand that they're part of their care here at Bon Secours. So change is here. It has begun. It started with Project Red, which is re-engineering discharge. We've got some great programs that came into play from Project Red. We implemented the Bedside RX program, which is soaring. We have Ashley over there, Ashley Champany, who's leading that for us. And I would like to give a little bit of kudos out that Ashley is the pharmacy tech who's heading that, and other facilities have done it through a pharmacist. And yet ours is soaring and soaring higher than Richmond's, and they're going to start looking at the way she's doing things to try to implement it across species, which is great. Yes. And the other thing we have is Pathway to Excellence, and then eventually magnet status. So clinical transformation, this you're going to be hearing a lot about. The next 3 things we're going to talk about. It's basically our effort to improve quality and to reduce the cost. To improve the quality in areas of focus are mortality, infections, and the care processes, and to help reduce costs in the areas of readmissions, hospital-acquired infections, and extended length of stay. So we talk about our role, and of course it's our role to help with clinical transformation, and we can all see areas of improving there. If you look down on your handout, you'll notice it says holistic care to each individual patient. There that word goes again, holistic, so we need to look at the patient as a whole. The leader of clinical transformation is Sarah. Sarah, you could just wave or stand up for us. So if you have any questions about clinical transformation, she's your go-to. And also on the internet at clinical transformation, there's a whole overview of how Bon Secours is approaching this. Pathway to Excellence. The goals of the Pathway to Excellence program is that it embraces the visionary concepts of a healthy work environment where nurses can flourish, a collaborative atmosphere, positive nurse job satisfaction, balanced lifestyle, which we've already seen through our healthcare, helping us with that, and Sarah's boot camp. Also, that nurses feel their contributions are valued. So it's, talking about the pathway, it seems like it's a lot about nurses, but the one thing we need to remember is that the hospital is made up of 80% picture here identifies the 5 components of magnet, and there's structural empowerment, exemplary professional practice, transformational leadership, new knowledge and innovations and improvements, and of course empirical outcomes. There's a little statement there on your handout about the ANCC and Pathway for Excellence in Magnet, if you'd like to look at that. Also at the end, we have a few handouts up here that kind of go over if you just want to look to where the future of Maryview is headed and what you can do to help in that. For the Pathway to Excellence in Magnet lead, that's Anita Jackson. So Anita, if you could wave or stand or something, let everybody know who you are. She's going to be taking us down this path, and she does have a good task ahead of her, so any input and help we can give her, I'm sure would be greatly appreciated. And of course, if we have any questions, she can help us on that. So when we start talking about all these things, some of the frequently asked questions are, am I supposed to act perfect? Do I not share that I've made a mistake? So I don't get in trouble? What's going on? And the answers to that are pretty simple. No, we're not perfect. No, we do not have to be. No, we do not have to pretend to be perfect. When we make a mistake, which is going to happen, what then? Well, we're going to learn from it. We're going to share it with staff that can learn from it. We need to use it to not let it happen again. And we need to find the problem and fix it. If we don't know the problem and don't involve people to help fix it correctly, or the proper identification of these departments, how can we correctly fix the problem so it doesn't happen in the future? So we just need to remember that. And remember, if you don't know how to do something, please ask for help. There's no shame in it. Asking for help is actually a sign of intelligence, and we need to remember that. So, who are Lynn and I? Lynn and I are part of Clinical Transformation, which, like I stated earlier, falls under Sarah Cullen. Our title is Heart Failure Nurse Navigator. Our program developer and leader is Dr. Gary Levy. He is the medical director of the Heart and Vascular Institute in Richmond. Our leader here is Sarah, and like I said, she's the clinical transformation lead. So just a few things before Lynn comes up. Heart failure is said to be the most costly cardiovascular illness in the United States. Heart failure is also on the rise in the United States, according to the American Heart Association. Also, not just heart failure, but heart disease is the top killer of women, even beating out all cancers combined. So we need to realize the strength in heart failure and how much we're putting into it. So talking about what is a navigator, Lynn's going to go deeper into that for us and a little bit more, and I'll see you back in a few. Howdy. big aspect of their workload, is putting in. And other facilities around here did let go of their secretaries. We did have a situation where a hospital, Bond Sports Hospital, approached us. Joint Commission came in. They did not have a process to make these follow-up appointments. They have 60 days to implement the process. They came here to Maryview. Maryview's process will be rolled out across Wishy. So for the first time, we are first, not Richmond. Yay! So some of the secretaries that they have let go, and the positions, unfortunately, that have, been done away with, they'll be re-looking at and seeing what they can do as far as hiring people to fulfill that role.
In our daily